So the next topic in general surgical discussion is wounds. This is one of the very basic topic, just like any other which we are talking till now, isn't it? Like cyst, like ulcers, like any other basic topics. Wound is also very basic one, and every student should know what is the meaning of wound, what is the classification, how you approach if a patient comes with wound in the hospital, means what type of wound is this, what is the cause of that wound, how I move further regarding the treatment, how the wound heals, what are the factors that retard wound healing, okay, and what are the important types of surgical wound. So with this, let's enter into the topic. See this, start with the definition. Wound is an injury usually involving the division of tissue or rupture of the integument or mucous membrane. Integument means skin, due to external violence or some mechanical agency rather than disease. So what is the meaning of this? There is some external injury, okay? There is some external injury, either because of surgery, which we routinely do in the hospital, or because of some trauma. There is rupture of the skin or mucous membrane, and that is called wound. Now, let's classify. I'm sure this topic is not very new. Probably when you study forensic medicine, during that time also this classification was done. Okay, so if it was done, let's take it as a revision. If it was not done, then please pay attention here. The first type of wound are known as abrasion. Abrasion or grazes. Abrasion is a commonly used term. See here, okay, abrasions. These are caused by tangential application of blunt force. There is no sharp force. The force here is blunt, and the direction of that force is tangential. This is the important point. In other words, because of this tangential blunt force, there is a lot of friction, okay, which is there on the skin, and that will cause abrasion. Dirt is often ingrained in the surface of the layer of the skin in abrasion, and that dirt, okay, can have the risk of short-term infection there if not treated in time. If it is not removed in time, then it can lead to permanent tattooing of the skin because of a lot of extra foreign material which is driven inside the skin, okay, that can cause tattooing. Just looks like a tattoo, but actually it is caused by injury. Whereas another type of wound is called contusion, also known as ecchymosis or bruise. But frankly speaking, ecchymosis is not a good term here, because ecchymosis is a type of, yes, anybody tell me what is ecchymosis actually? I'm sure you know this. Anyone? Ecchymosis means what?
Sir, it is discoloration of skin, sir, from bleeding underneath mainly.
Absolutely agreed. Yes, you're absolutely correct. Ecchymosis is one of the manifestation of bleeding, especially because of bleeding disorder like ITP, okay, and other type of bleeding disorder. It is a blue type of patch which is formed on the skin or subcutaneous area. It is not usually caused by trauma. Whereas contusion or bruise, okay, they result from blunt force. Now see here, which disrupt the superficial capillary. The capillaries are ruptured because of that blunt force, whereas the overlying skin is intact. This is absolutely important point when you talk about contusion or bruise. The overlying capillaries are intact. There is no overlying cut on the skin. This is caused by blunt trauma. When these small blood vessels are involved, a large collection of blood, which is known as hematoma, may develop. It depends on the force of the injury. And when that is not, treated in time, or that clot remains there, then it will undergo some changes. it will change its color. Remember, it may look yellow because there is a presence of RBC. From those RBC, bilirubin will be formed. You all know the pathway. From the heme, okay, biliverdin will form, and from biliverdin, the bilirubin will form. So sometimes later, the color of that contusion or bruise may look yellow as well. Okay, so if it looks yellow, we know it is already 18 years or 18 hours old. Sorry, 18 hours old. Means some time has to be given for that bilirubin to synthesize. So let me repeat again. Contusion or bruise are the result of blunt force which rupture the superficial capillaries, but the overlying skin is not cut, it is intact. And it is very easily confused with ecchymosis. Ecchymosis are blue patches which are seen in bleeding disorder. There may not be any history of trauma in case of ecchymosis. Let's move on. Now see this. Now can you tell me, is this abrasion or bruise? What is this? What do you think? This is abrasion or bruise? Yes, please.
Bruce also. So I think Bruce.
Abrasion, sir.
It is abrasion. It is abrasion. It is very superficial. Okay, it is quite superficial, and it looks like some friction is applied on the superficial or surface of the skin. So this is a typical picture of abrasion. And now see there, this is bruise or contusion. This is bruise. It looks a bit deeper. There is a blue patch present there. It is caused by a blunt force or trauma which results in rupture of the capillaries there, and the overlying skin is not cut. So this is contusion or bruise. Now let's move on. The other types of wound is laceration. Now, lacerations are severe type of wound. Now let's know the meaning of laceration. They are also caused by blunt forces, but these blunt forces are slightly sharper. It is not by a big flat stone. Probably if that stone is a relatively pointed one, the edges are not very sharp. I'm not saying that, but the edges are a bit sharper than other type of force. Then what they do now, they can tear the skin, they can shear or crush the skin as well as soft tissue, and this type of wound is called laceration. If I pay attention and examine that wound carefully, the edges of the wound are quite irregular. This is a hallmark of laceration. They are irregular. Remember, in case of sharp cut, the edges of the wound are quite regular. But these are irregular in case of laceration. They are often abraded, they are often contused and crushed because the force is blunt, okay, especially. When you see the picture, it will be very clear. Laceration. They are considered serious type of injury. The other type of wounds are incise wounds or cut. Incise wounds are cut. Now they are produced by sharp edges, like knife, okay, or glass shards, and have characteristically clean edges with clear margin. A perfect example is knife wound. If you are cutting something, some vegetable or some fruits or something like that, accidentally, when you cut your finger or when you cut your hand, that type of wound is called incise wound or the cut. The cut which is given by the surgeon to the patient when they operate is also known as incise wound or the cut. The greatest dimension of an incise wound is its length. There's no doubt about it. Okay, the width is very, very small. The width, you just give a cut there. So the longitudinal length is the important one. Let's move on. Now, there is one more type which is called puncture wound. What do you mean by this? When we, puncture the surface of the body by some sharp instrument, for example, a nail, for example, a knife itself. The knife can produce incise or cut wound. Okay, if we use that knife on the outer surface of the body, but if you drive that knife to the inner part of the body, it can cause puncture wound. So this is the meaning. Now let's talk about it. So puncture wounds are caused by sharp points or edges, okay, in which the greatest dimension is the depth now, because it is going deeper. And there are two types. One is called penetrating, another is called perforating. Now, penetrating type of puncture wound and perforating type of puncture wound. Now, let's distinguish between them. When the wound pierces a body cavity, it is called penetrating, like a knife injury which has entered into the peritoneal cavity. This is penetrating injury, isn't it? But if the same knife, okay, penetrates through the intestine or stomach and made a through and through opening, this is known as perforating. This is known as perforating. So let me explain once again. Somebody has attacked another person with a sharp knife. Okay, that knife is in the abdomen. Now, when the surgeon opened that abdomen, they have found that, okay, the edge of that knife, okay, the pointed part of that knife has gone into the intestine and it has come out from the other side of the intestine. Means there is through and through opening there, and this is known as perforating injury. Let's move on. Now see this picture, it will make your concept quite clear. These are schematic diagram, but highly informative one. Now, why this is laceration? Now, can somebody answer why this is laceration? Yes. What are the important points in laceration?
Edges are irregular edges, sir.
Very good. Irregular edge, excellent. Yes. And
Edges are irregular.
edges are irregular. That's the most important point. Okay. Anything else?
So that contuses like it's like
Blunt force, sir.
It is caused by blunt force, but you cannot see the blunt force here. But that's a very good point. I accept your answer. And one more thing, if you look at the edge, see this. If you look at the edge, which is not clearly seen here, but you need to remember that the capillaries which are present at the edge of the wound are crushed. So a bit of bruise or contusion can be seen on the side.
Blood vessels are crude.
Yes, blood vessels are also crushed. Okay, so the amount of bleeding is not that massive in case of laceration. Now you may be wondering why, because the wound looks so bad. Why the blood flow or blood loss is not that massive? The reason is very simple here, because those capillaries or blood vessels are also crushed. Okay, they are not properly opened outside. That's why the bleeding is not massive. What is the diagnosis here? Which type of wound is this? Which type of wound is this? Yes?
laceration, sir.
This looks like laceration, isn't it? This looks like laceration. This is a very easy answer because look at the nature of the wound. It looks very complicated one. On the surface, on the adjacent side of the wound, there are some bruises. I can see contusion, a little bit bluish in color. The edge of the wound is very irregular. Okay, so all those different things are there. It cannot be abrasion. Abrasion is very superficial. It cannot be bruise. Okay, and the bruise, there is no cut on the surface. So this is a laceration. So from this class, okay, I'm sure every student can identify which type of wound is this. Okay, this is a very important type of question which is asked in the Viva exam and different other exams. Let's move on. Now one more slide for you, okay, which is showing the different types of wound. So let's take a bit of time here. See this is abrasion. This is abrasion, a little bit looking like a tattooing actually. Tattooing is a feature of abrasion. This is a puncture type of wound. Puncture or penetrating type of wound. It's the same thing. A nail is causing puncture wound here. Now, this is a clean cut wound. Okay, cut wound. This is laceration. You can clearly see. Look at the edge. It's quite irregular. Okay, laceration. This is known as avulsion, also known as amputation. Avulsion or amputation. Now, avulsion. See this. The tip of the finger is avulsed outside. The person has lost a small part of tip of the finger. This is avulsion type of wound. And if a relatively larger part of the finger is lost, we can also call it amputation. This is not a surgical type of amputation. This is traumatic amputation. But we can still use the term. Another picture, okay. Now see this. Abrasion, very good schematic diagram. Abrasion, laceration, okay. Avulsion, one big chunk of the tissue is avulsed outside. Avulsion, incision, puncture wound, and amputation. See that what I'm talking right now? This is amputation. Almost half of the thumb is disappeared. So this is amputation. So these are different types of wound. I'm sure every student have the confidence of classifying wound. Now let's move on to the second part of today's class. What are the steps of wound healing? Everybody should know about this steps of wound healing. Important question in the exam. Now the different steps are, it may start with coagulation in the beginning, followed by inflammation. Inflammation is a part of wound healing. From the lecture of pathology, you know this point. Inflammation can be early as well as late. We'll talk about every of these steps. Then there is a synthesis of collagen. Without collagen synthesis or without collagen fiber, the strength of that healed wound is not good. Angiogenesis. What is the meaning of angiogenesis?
The
Anyone?
angiogenesis formation of new blood vessels.
Formation of the new blood vessels.
Excellent. Formation of new blood vessel is known as angiogenesis. Excellent. This is a very important step of wound healing. And after angiogenesis occur, there is formation of, okay, the immature type of scar, which is known as granulation tissue. Angiogenesis is the important part of granulation tissue. Then there is epithelialization. There is a regeneration of epithelial cells. And then finally, there is contraction of the wound. And this is also known as modeling as well as remodeling. So these are steps of wound healing. So let's elaborate them one after other. Now, all of you, please focus on this slide. Okay, see that please. Now, let me explain this for you. There is an injury here. How we know there is an injury? See this is a wound. There is a discontinuation of the skin. This is skin surface, and this is the discontinuation of the skin surface, and this is caused by the external injury. That's why we call it wound. Okay. There is a neutrophil present, okay, on the tissue. Inside the blood vessels, actually, the PMN are present, macrophages are present in the tissues, and inside the blood vessel, if macrophages are present inside the blood vessel, they have got separate name. What we call inside the blood, what we call that cell, and when it goes outside we call it macrophages. What is the name inside the blood? Yes,
Monocyte.
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 Very good, they are monocyte, don't forget. Okay, so many of the time we exchange these terms. Monocyte will form macrophages when they go out from the blood vessel into the tissue. Now there is a leakage of the blood, these are the RBC, so there is a wound. Now what happens in the beginning, after the wound is formed, there will be coagulation, there will be stoppage of the bleeding, and that is happened by aggregation of the platelet, by activation of the platelet, and activation of coagulation cascade. We have studied that before. The two pathway of the coagulation, external and internal pathway. But platelets play a big role in the coagulation. See there, ultimately there is a fibrin formation. This fibrin is the end product of coagulation. Now, within 24 hours, there is early inflammation occurs. Early inflammation is highlighted by the collection of PMN. What's the full form of PMN? What is PMN? Anyone?
Polymorphic neutrophil.
Yes, Abbas. Polymorphonuclear cells. Polymorphonuclear cells. Okay. They are also known as neutrophil. Neutrophil is the other term of PMN cell. Polymorphonuclear cells. So in many textbooks it is written like that, so don't get confused. That's why I've explained this. So this is highlighted by the collection of neutrophils on that area. And there is a role of, see there, transforming growth factor beta and platelet derived growth factor. This is transforming growth factor beta, and this is PDGF, platelet derived growth factor. Now within 48 hours there is late inflammation, and late inflammation is highlighted by the collection of macrophages. Now these macrophages are present in the tissue. This is in very short they are explaining it. Okay, later on we'll elaborate this in detail. Now within 72 hours there is proliferation, the synthesis of collagen, the fibroblast will come into the picture. Okay, so and after that the epithelialization also occur, and there is contraction of the wound, which is known as remodeling. It takes a long time for the remodeling to happen. It takes weeks to months, and ultimately there is a scar formation. So this is the different steps of wound healing. Now let's elaborate these steps one after other. The first step is coagulation. Now see here, this coagulation begins following the wound formation. It begins following wound formation. Definitely, whenever there is a cut, whenever there is trauma in any part of our body, the first thing is hemostasis. And hemostasis occurs by three important ways. One, by contraction of the blood vessel, which is by sympathetic nervous system activation. Second, platelet plug formation. And third, okay, fibrin clot formation. So this is known as coagulation. Coagulation and complement cascade are activated, and platelet create a hemostatic plug. That's what I was talking right now. Meanwhile, there is release of various inflammatory mediator from the activated platelet. One of them is called platelet derived growth factor, and it will cause different type of mechanisms there, a different type of phenomena. Now during this time, if the patient use anticoagulant drug, if the patient use antiplatelet agent, and if there is coagulation factor deficiency, then this coagulation, will have a problem. So if coagulation will have a problem, there is be prolonged bleeding from the wound. Now let me ask you some question here. Everybody know the example of anticoagulant drug, isn't it? Can you tell me once again?
Yes.
What are those anticoagulants?
Sir, Varuzaban, enoxaparin, sir, epizaban.
Okay, good, good, very good answer. But you can simply say heparin and warfarin to a teacher. They'll be quite impressed by that answer. Okay, heparin, low molecular weight heparin, and warfarin. These are the very commonly used anticoagulant drugs. Now, on the other hand, okay, what are the antiplatelet agent? Antiplatelet agent. What are those? Yes, yes, Harish.
Clopidogrel, sir.
Clopidogrel, good.
Aspirin.
Aspirin.
Aspirin, yes, don't forget aspirin, probably the most important antiplatelet agent.
Low molecular weight heparin.
Ticagrelor, prasugrel.
Okay,
Dipyramidamole, sir.
exactly.
Low molecular weight heparin.
Acetyl salicylic acid, sir. Acetyl salicylic acid.
Exactly, also known as aspirin. Okay, now all of you please pay attention here. Very important question. You have studied this in pharmacology already, but see there, we are learning surgery right now, but this is the way your teacher asks the question. The important antiplatelet agent in clinical practice is aspirin or acetyl salicylic acid. Aspirin, never forget this. Aspirin is given in a quite low dose for its antiplatelet effect. But for the analgesic and anti-inflammatory effect, we have to give aspirin in a high dose. Okay, this is a small practical information. Another important drug is ticlopidine, clopidogrel. Okay, these are some of the important drugs. There's so many. Okay, so if you say these 2 to 3 drugs, no more question. We are not taking the viva pharmacology here. I just want to give you the concept. Now, coagulation factor deficiency, a perfect example is hemophilia A and hemophilia B. Now, hemophilia are caused by factor 8 and factor 9 deficiency. A by factor 8 deficiency, B by factor 9 deficiency. Now, one more thing, the coagulation problem also occur in chronic liver disease as well as uremia. Now, let me ask this question. Why in chronic liver disease there is a problem in coagulation? Why? What's the reason?
Sir, because many of the clotting factors are synthesized in the liver, sir.
Good. Yes, Zulfikar. Yes, I'm hearing. Go on. Okay, fine. So I already got the answers here. Okay, many of the students also know that. I'm 100% sure about it. That's the function of our liver. If liver is diseased or damaged, the different clotting factors cannot be synthesized as well as activated. There are 2, 7, 9, and 10 clotting factors leading to coagulation defect. And uremia. Uremia is a condition in renal failure or chronic renal failure. Because of the collection of the toxins, okay, the platelets can become dysfunctional in case of failure, which can lead to problem in coagulation. Let's move on. Now, the second important steps of wound healing is inflammation. Let's elaborate on that now. The signs of inflammations are pain, swelling, heat, redness, and loss of function. Okay, this is very basic thing, and I'm sure you have already studied this before. Pain, swelling, heat, redness, also known as erythema, and loss of function. Inflammation occurs as a result of wounds being invaded by polymorphonuclear neutrophils, okay, through the first 24 hours, and macrophages, okay, which attains its peak number at 48 hours. That's why it is also divided into early inflammation and late inflammation. Early PMN and late macrophages. Macrophages are very essential for wound healing because they release certain factors which are necessary for wound healing. Now, what is the importance of this inflammation? Why? inflammation has to be there. Why? It is an important part of wound healing. So this type of concept you should have. Now see this: bacteria, cellular debris, different type of dust or dirt, and other foreign materials which may be present at the site of the wound, they are cleared by these macrophages and neutrophils. That is the importance of collection of those cells at the wound site. There may be different bacteria there. There may be different dust or dirt, some foreign particles or materials, and some cellular debris, means damaged particles of the cell. Now, at this juncture or at this moment, if the person is taking steroid or any other immunosuppressive agent, okay, there is decreased amount of inflammation because these are immunosuppressive agents. And if the person is having congenital or acquired immunodeficiency state, then also similar type of things may happen. Now, everybody know the different types of corticosteroid, but still I want to ask that question. Tell me the different types of corticosteroid here. Yes, different example.
There are short duration,
Good. Go on. Yes.
immediate duration, hydroxycortisone, and dexamethasone.
Good. Good answer. Good answer. Okay. So let me add some more there. He said hydrocortisone. Excellent. Hydrocortisone. Then prednisolone. Very commonly used drug in the clinical practice. Prednisolone. This prednisolone is a moderate acting or medium acting. Hydrocortisone is a short acting, and dexamethasone and betamethasone are long acting type of corticosteroid. There is one more known as triamcinolone. This is also a medium acting type of corticosteroid. There are so many other. Okay, so you can memorize this name, but once again I like to tell you this: whenever this type of question comes, quickly say 2 to 3 names, teacher will be satisfied. Now, what are the other immunosuppressive drug apart from steroid? Give me a few examples. What are those?
Anti-cancer drug like isoniazid, rifampicin,
So the
and
anti-proliferative drugs are like the calcineurin inhibitor, like
Okay.
tacrolimus, like
Good.
sporin.
Good.
So we've got the M2R inhibitor, like the sirolimus.
Good. Very good. Okay. The concept is there. So let me clarify this again. This is another important question for you in the exam. So just take those names which you know very commonly, the easy names for you, like cyclophosphamide, okay, cyclosporine, azathioprine, mycophenolate mofetil, isn't it? Tacrolimus. Okay, these are different type of drugs. Even methotrexate, different drugs. Most of them are anti-cancer drugs. So just remember that and take few names. Now, some of the examples of congenital immunodeficiency disorder. Congenital, like Bruton A gamma globulinemia. Bruton A gamma globulinemia, isn't it? Common variable immunodeficiency disorder, severe combined immunodeficiency disorder, Wiskott-Aldrich syndrome, DiGeorge syndrome. So many different types are there. Just take few of them. Let me repeat again. Bruton's A gamma globulinemia, common variable immunodeficiency disorder, severe combined immunodeficiency disorder, Wiskott-Aldrich syndrome, and DiGeorge syndrome. These all are congenital one. And acquired, these days the most important acquired immunodeficiency disorder, which is also considered as a pandemic. Okay, what is that? What I am trying to say here?
coronavirus.
No, before coronavirus. Coronavirus is very recently, came into the picture. That virus was there for a long time. HIV, okay, HIV and AIDS. This is also a pandemic. Remember that it is present in almost everywhere in the world. HIV and AIDS, there's a pandemic diseases. So HIV and AIDS is a very important example of acquired immunodeficiency condition. Others are diabetes, okay, diabetes, cancer, connective tissue diseases, and some chronic infection in the body. All of we're talking about different steps of the wound healing. So before the break, we talk about the first step, that is a coagulation, and after that it's inflammation. Inflammation can be early as well as late. Now the next step in wound healing process is collagen synthesis, and this is a very important step because collagen synthesis gives strength to the healed wound or gives strength to the scar. The collagen synthesis is done by fibroblasts. These fibroblasts are present in the vicinity of the wound, and they come there in response to various growth factor peptide, like platelet derived growth factor is one of them, transforming growth factor beta is another one, few of the examples, okay? So they are attracted to the site. For the synthesis of collagen, we need amino acid like hydroxyproline and hydroxylysine. They are the components of collagen, and it also depends on iron, alpha ketoglutarate, and vitamin C, which is known as ascorbic acid. Iron, alpha ketoglutarate. Remember, alpha ketoglutarate is a component of Krebs cycle, isn't it? So it is synthesized from glucose. So these are the different things. So if any of these are deficient, especially the vitamin C, which is known as scurvy, or if there is deficiency of iron, in case of iron deficiency anemia, or if there is a case of malnutrition, then collagen synthesis cannot happen properly. Another step is angiogenesis, and angiogenesis is an important part of granulation tissue formation. This angiogenesis or new blood vessel synthesis occurs in response to peptide growth factor, and the most important peptide growth factor here is vascular endothelial growth factor, VEGF, vascular endothelial growth factor. Okay, so this is important point. The name itself suggests vascular endothelial growth factor, which stimulates the synthesis of new blood vessel. After these new blood vessels are formed, the appearance of that granulation tissue becomes beefy red in color, or it looks quite red in color, and we call that healthy granulation tissue. Healthy granulation tissue should look red. Apart from that, if it looks a little bit grayish white, or still if there is some necrosed tissue or something like that, then that is not healthy granulation tissue. Now another step, okay, for the wound healing process is called epithelialization. Epithelialization means regeneration of epithelial cells in that particular area, and they from where they come, that's an important question, isn't it? Because that area is already damaged. We are talking about the wound healing now. They come with the migration of epithelial cell over the wound defect from the side. Okay, they are migrated from the side. That is important point. Now, one of the important component of epithelial cell is the basement membrane. This basement membrane, okay, has type 4 collagen in it. Please mute yourself. It has type 4 collagen in it. Different types of collagen, okay. Importantly, type 4 collagen is present in the basement membrane. This can be asked as an MCQ question in the exam. When epithelialization occurs, if there are certain foreign bodies present in the wound still, like suture material, some necrotic debris or necrotic tissue, they are separated from the wound. So this is a very important step, and we can remove them easily if they are not removed earlier. After the process of epithelialization is complete, the wound essentially becomes waterproofed. Okay, so this is another important step of wound healing. So what are the steps we talked till now? The first is coagulation step, second is inflammation, early and late. Okay, the third is synthesis of collagen by the fibroblast. After that, angiogenesis or new blood vessel formation, and then epithelialization. Let's move on. Now, at the end, okay, we have contraction and remodeling. Now, contraction and remodeling is an important part of wound healing process because the granulation tissue may be quite big in the beginning. So that granulation tissue should mature first and then it should contract. That is known as contraction. This is mainly done by myofibroblast. Now, see here. This is done by myofibroblast. They are a type of fibroblast. And these myofibroblasts have a special property. They can contract. And with the help of this contractile nature, the wound can contract and become smaller. Very, very important process. Do not confuse wound contraction with scar contracture. These are the different things. Scar is a mature type of granulation tissue. It takes a long time to form the scar. Okay. Maturation of the scar occurs over the next 9 months to 2 years. Look at the duration, it is quite long. That's what I mean just now. And this maturation of a scar is occurring by cross-linking of the collagen. Okay? These are the collagen fiber, which makes that wound stronger, and clinical flattening of the scar. So these are the two mechanisms by which remodeling of the wound occurs. So let me make it very simple for you. After epithelialization, after the formation of granulation tissue, with the help of myofibroblasts, that is contraction of the wound, and the scar form after many months to years. It will take a long time for the scar to develop and to form. And later on, the scar will become flat. Now, if the scar are not flat, if the scar is coming above the wound or going, nearer to the wound, we call that abnormal type of scar, and these are known as hypertrophic scar and keloid. Hypertrophic scar and keloid. So let me write those terms here for you, and later on we are going to explain that. Hypertrophic scar and keloid. These are abnormal type of scar. Normally scar looks flat, but this type of scars are big. Okay, they are pathological scar. Let's move on. Now, one important question which is asked to the student is, what is granulation tissue? So let me ask that question once again. What is granulation tissue? Who can answer this? Yes, anyone?
So, sir, it is a new type of connective tissue, sir, that form on the surface of a wound, sir.
Okay, good. You have the concept, Uzair. Very good. Yes?
New type of connective tissue and tissue blood vessel.
Good. Zulfikar, I also accept with your answer. Anybody else?
So it is immature.
It's an immature type of scar. That is also acceptable answer. See this? So the three students have answered in a 3 different way, but the meaning is there. Okay, and the meaning is granulation tissue is formed by fibroblast, it is formed by new blood vessels, and it is formed by epithelial cells. So every component is there, and this is a early or immature type of scar. After this granulation tissue matures, we call that scar. So remember this. And what is healthy granulation tissue? In the last class, in the topic of ulcer also, we talked about this. Healthy granulation tissue means it should look red. There are new blood vessels, and if we touch, okay, or if we give a simple, pressure, It may bleed easily. These are the features of healthy granulation tissue. Now let's come to this slide. The presence of granulation tissue is reassuring evidence that the healing process is underway. Now it is occurring normally. That is the meaning. At 1 month post-injury, the wound is at approximately 85% of its ultimate cohesive strength. Still 15% is left, and that 15% strength is attained over a long period of time. But the person can manage with 85% cohesive strength of the wound. Epithelialization of surgical wound closed primarily is usually complete by 24 to 48 hours. Now, later on, we'll talk about wound healing by primary intention and wound healing by secondary intention. And during that time, it is quite clear to you what I'm talking about here. For example, if the surgeon has cut the skin with a scalpel, this is a clean cut, incise type of wound. And after that, what the surgeon would do, they'll put the suture there. So the edges of the wound will be brought very, very near to each other, almost opposed to each other. They're joined with each other. And that epithelialization will occur in 24 to 48 hours in those type of wounds. But if there is a large, piece of the skin or tissue is lost, it's, of course, naturally, it will take a long time to fill that area. Now, another part of today's lecture is the classification of surgical wound. Okay? This is in the hospital where the surgeon is, operating on the cases. What are these different wounds? The first is a clean surgical wound. Clean. For a wound to be considered clean, the following characteristic feature must be true. Like, the wound is created in a sterile fashion in an area that is free of pre-existing inflammation. Sterile fashion. The whole environment should be aseptic. The whole environment should be sterilized, number one. And number two, there should not be any infection or inflammation in that area. This is a very important point. Another important point is the respiratory, GI, genital, or urinary tract should not be interred. They should not be interred, or there should be no connection between the wound and these tracts. And third, all persons involved in the case maintain strict aseptic technique. And that's what they usually do in the operation theater. So this is known as clean wound. Now let me give you an example. The surgeon is doing laparotomy. Laparotomy is done by giving a midline incision in the abdomen or paramedian incision. There is no, previous inflammation or infection there on the skin. Okay, everything is done under strict aseptic precaution. So this is a clean wound. This is an example. Let's move on. Now the second type of surgical wound is called clean contaminated wound. Okay, clean contaminated. What do you mean by that? In this case, the respiratory, alimentary or GI tract, genital or urinary tract was interred. It was interred. Probably the surgeon has given incision on those tubes, but there was no significant spillage of its contents. All of these have got certain contents, isn't it? The respiratory tract has got air and mucus there. Alimentary tract has got fecal matter. Genital and urinary tract has their own content. So after the surgeon has given incision on the surface, if the content come out or spill outside, this is known as clean contaminated wound. But one important thing, there should not be any established local infection before. There should not be any infection prior to this wound. There was only a minor break in aseptic technique in this situation. Now, why we are talking like this? Okay, there has to be some relevant point, isn't it? And the relevant point is here. The risk of infection for wound. In case of clean wound, the risk of infection is 2%. In case of clean contaminated wound, which we are talking right now, the risk of infection is 5%. In case of contaminated, it's 15%, and in case of dirty wound, it is 35%. Now, you may be wondering, what is this contaminated wound and the dirty wound? Okay, so let's talk about them. See here, the contaminated wound means there is a gross spillage from the GI tract. Now, the content of GI tract is the fecal matter. So what happens sometimes when the surgeon is doing laparotomy, the surgeon found there is intestinal obstruction, and the surgeon has to give nick or incision on that part of the GI tract, and accidentally there may be spillage of the fecal matter into the peritoneal cavity, or it may contaminate the wound or the incision which the surgeon has given. So this is known as contaminated wound now. The genitourinary and biliary tracts were injured in the presence of local infection. The infection of the biliary tract is known as cholangitis. Cholangitis. See here. So in the presence of cholangitis, if the surgeon has operated, now let me give you a clinical scenario here. Cholangitis very commonly occurs in biliary stone, especially if that stone has slipped into the common bile duct. Now it will get infection. This is known as cholangitis. Now, what is the treatment of obstruction of the common bile duct? It's surgery. We need to remove that obstruction. We need to remove that stone. So the surgeon has to give incision on the common bile duct and remove the stone. So during that time, okay, that wound was definitely contaminates by the bile which is present inside. So this is an example of contaminated wound. It may also occur as the result of recent trauma, and there is a major break in aseptic technique in case of contaminated wound. Right now, we are talking about classification of surgical wound only, okay? Not the general type of wound. Now, one more variety of the surgical wound is called dirty or infected wound. Very easy type of concept this is. The wound is already infected, probably. There is already some abscess or some pus, collection of the purulent material there. And the cause of this collection of the pus is from the remote or distant trauma or prior trauma, which is causing the collection of the pus as a result of infection. On top of that, that area also has dead or devitalized tissue along with purulent material. One more thing you need to remember in surgical wound classification regarding the dirty or infected wound is, if we operate on perforated viscera, okay. Now, can you give example of perforated viscus or viscera? Few example, which are those situations where there is perforation in our GI tract? Anybody? Which are those conditions? Like perforated peptic ulcer. Very good. Perforated peptic ulcer. You must have heard this before. Another is rupture of the appendix. Rupture of appendix. And third one, okay, typhoid, okay, ulcer perforation. Typhoid ulcer perforation. And fourth, you are right, even bowel obstruction. After bowel is obstructed, acute type of obstruction, there may be perforation also. But these are more common. So what happens now? The surgeon needs to operate on the patient by doing laparotomy. So all of these are example of dirty or infected wound, and there is high chance of secondary bacterial infection there. Now, with this concept, okay, let's talk about what are these types of wound healing. What do we mean by healing by primary or first intention, and what do you mean by healing by secondary intention? Another very important concept, and this is an important part of today's class. Now look at this picture first. Okay, this is a wound. There is a big gap there, isn't it? This is a wound. And look there, how the wound is treated. The two edges of the wound are brought quite close to each other. Means the two edges are actually opposed to each other. Okay, and then the suture is applied. This type of wound heals by primary intention. When we bring both edges opposed to each other, okay, the healing occurs by primary intention. And usually the surgical wound which is given by the scalpel or caused by scalpel are usually healed by primary or first intention. Now see here, generally clean traumatic laceration are closed with suture or staple, and the healing in this situation is known as healing by primary intention. But we need to be very careful. If the patient comes to the hospital prior to 6 to 8 hours of injury, then only you can think about putting the suture or staple there. If the patient comes later than 6 to 8 hours, even if the wound looks, like a clean cut type of wound, we do not put any suture there. Why? Why we do not put any suture in that situation? What's the answer?
Sir, because wounds.
Because of high chance of infection. Remember, there is already a lot of time spent. 6 to 8 hours means the wound must be contaminated by some microorganism. So if we put suture there, those microorganisms are lodged inside, okay, underneath the suture. They can easily cause infection there. So what should you do? Keep the wound open, clean it, debride it, okay, and later on when the infection or inflammation settles, then you can close the wound. So with this concept, let's talk about healing by primary intention in a little bit elaborated way. Following closure of clean surgical wound or traumatic laceration in which there is a minimal devitalized tissue and minimal contamination, we go for a suturing or staple, and that is known as healing by primary intention. Remember these two terms, suturing and stapling. This staple is a very advanced type of way, or a modern technique I should say, for the closure of the wound these days in the hospital. Now in this condition, the edges of the incisional defect are approximated with the use of suture staple. That's what I was talking right now. And the defect is very small there. So re-epithelialization occurs quite rapidly. It may occur within 24 to 48 hours. And that is quite fast type of healing. It's quite fast type of healing. After that, we can dress, and the dressing change can be done after 24 to 48 hours. Okay, and in this condition, the wound strength reaches its maximum at about 3 months. 3 months, and generally it is 70 to 80% of that of the normal skin. And the person can do all routine or general type of activity by this much type of wound strength. 70 to 80% is a good wound strength. So this is known as healing by primary intention. See this, within 3 months everything will be all right. Now when you talk about healing by secondary intention, then the concept would be even more clearer. And this is a common question which is asked by your teacher. What are the differences between healing by primary intention, secondary intention, or even tertiary intention? Now see here. Following the closure of wound that are not approximated with suture, the healing occurs by secondary intention. all wounds cannot be, treated by suture application. Now let me explain this point here. There is a big loss of the skin. There's loss of the subcutaneous tissue also. How can we apply suture there, isn't it? The two edges will not come closer with each other at all. So suture is not applicable during that time. Grossly contaminated wound, we don't apply suture during that time. Okay, so they heal by second intention. The same thing is explained here. These are the reason for not using sutures, and they are: the wound edges cannot be opposed because the defect is very large. A good example is donor site of the skin graft. That means skin graft is taken from one part of your body and it is put in another part. Now from the area where we take the skin, there is a big defect, and we don't do anything there. The skin will slowly, comes back to the normal later on. It will take few weeks. Another reason, the surgeon chooses not to close the wound primarily because of the high risk of infection. The different example I already gave to you. If you think the wound is contaminated, if you think the wound is dirty, if you think the patient has come after 6 to 8 hours of getting the wound, don't close it with suture. Allow it to heal by second intention. It should be packed loosely with some moist gauze and covered with a sterile dressing. This is the standard care of any wound, isn't it? And then it should be assessed daily for the development of granulation tissue. And remember, this granulation tissue should be healthy looking granulation tissue. There would be enough angiogenesis. It should look beefy red, and if you touch or give a little pressure, it should bleed. These are the features of healthy granulation tissue. An important point, there should not be any infection present. Let's move on. Now, you may be wondering, then how the healing occurs in second intention, isn't it? We just leave the wound open. We are not putting any suture or any staples there. How the wound will heal or close? The answer you already discussed just before the break. There are different stages of wound healing you have talked. The same stages of wound healing will come here into the picture. Now see here, the wound closes by contraction and epithelialization. In the beginning, don't forget those steps. In the beginning, there is coagulation, then inflammation, okay, then collagen synthesis, angiogenesis, epithelialization, and contraction. So all the steps are fulfilled there. Contraction occurs with the help of myofibroblast. Already know this point. And epithelialization proceeds at 1 millimeter per day, and it starts from the edges and go towards the center of the wound, because these are the sources of epithelial tissue. And ultimately, there is a formation of granulation tissue, and this granulation tissue will mature into the permanent scar. So a scar forms very prominently after healing by secondary intention. This is a take-home message from this discussion. And one point I like to highlight further: sutures are utilized in primary and delayed primary intention healing only. They are not applied in the healing by secondary intention. We allow that wound to heal by itself, and if necessary, you can put skin graft later on. And many of the time we need skin graft, because the skin is lost. We cannot allow that big wound to be open like that. So skin graft can be done later on. Now look at this picture and make your concept quite clear. So see this. There's a big wound. There is a big gap. There's loss of tissue there. And this is how the second intention healing occurs. Where are the sutures here? No sutures. Where are the staples? There are no staples. So we allow this wound to get filled by itself. There is one more type of healing which is known as healing by delayed primary or third intention. In some of the textbook, it is written as delayed primary, in other third intention. Now let's elaborate on this. See there? Okay. So it can occur following the closure of wound in which there is obvious cross contamination at the incisional site. And remember the different classification of the surgical wound. We call it clean wound, we call it clean contaminated wound, or dirty wound. So if the surgeon decide to close this wound by suture, okay, then the healing by delayed primary intention will come back into the picture. A good example here is following removal of a ruptured appendix in which there was leakage of pus into the peritoneal cavity, a perfect case of dirty wound. Okay, a perfect case of dirty wound. Now what the surgeon will do here? Let's talk about it. See this? In such cases, only the parietal peritoneum and the fascial layers are closed. Skin is not closed now. If you close the skin, okay, probably that infection is not going to get settled. The infection will further increase. So parietal peritoneum and fascial layers are closed, and we treat the patient with antibiotics for a few days. And after that, only the skin and subcutaneous tissues are sutured. So this is called delayed primary intention, okay, or healing by delayed primary intention, I should say. Now let me clarify again. This is done mainly in contaminated or dirty type of surgical wound. The surgeon's decision is the final here. If the surgeon thinks there is a high chance of infection, I will not close the skin, I will just close the parietal peritoneum, because we cannot open the parietal peritoneum and keep it like that, there is a big risk of entry of infection inside. We close it, close the fascia also, and then give good coverage of antibiotic. After 3 to 5 days, the chances of bacterial contamination has drastically decreased. Now the surgeon can safely close the skin. This is known as closure or healing by third intention. Okay. Now after knowing these different things, let's talk about one very important concept. What are the factors that affect wound healing in the patient? Now, when you start practicing as a doctor, you will realize this. Some of the patient, they heal their wound quite fast or quite rapidly. Some other, they take a long time for the wound healing. Why is that? Which are those factors which affect the wound healing? Okay, so let's elaborate on them. Those factors are roughly divided into 2 types: systemic factors and the local factors. Now, see there, let's talk about systemic first. Age of the patient. Older age, okay, patient have a decreased chances of wound healing. Means it is delayed. I'm not saying there's no wound healing in the older age, but it is slightly delayed than the younger one. Second is a nutrition. If the person is malnourished, or if the person is very obese, both. Remember, obesity is a disease. It's not a normal situation. In both those conditions, wound takes longer time to heal. Trauma, okay, which type of trauma, it depends. If there is a big loss of the tissue, definitely wound takes a long time to heal. And if it is grossly contaminated, it will take long time to heal. Metabolic diseases in the body, the wound takes long time to heal because of the effect of those diseases. Immunosuppression, no need of any explanation. Every student know this point. Immunosuppression, either congenital or acquired, or some drugs maybe. with the effect of the drug, wound doesn't get healed in time. And what are those important drugs once again? Can you tell quickly those two names? Which are those drugs which leads decrease wound healing? Which drugs I'm talking about here?
Steroid and immunosuppression.
Immunosuppressants and steroids.
Excellent. Excellent. Okay, we already talked about them. Immunosuppressive drug as well as corticosteroid. So if somebody is taking those drugs, for some other purposes, then wound doesn't get healed in time. Connective tissue disorders. There are different types. Okay, different types like SLE, like rheumatoid arthritis, Marfan syndrome, Ehlers-Danlos syndrome. All are different varieties of connective tissue disorder. There is problem with collagen, so wound will not heal in time. And smoking, okay, a person who is a heavy smoker, wound takes a longer time to heal. So these are the proven point. Now let's go to the local, even more important, mechanical injury. What type of mechanical injury? For example, laceration takes a longer time to heal. Okay, laceration. Then clean cut wound. Infection always takes longer time to heal. Until and unless the infection is clear, wound is never going to heal. So what our job? First, we need to treat the infection, give antibiotic, do dressing, okay, settle that infection first, and then only wound will heal. Edema. If there is collection of fluid in the wound, it takes longer time to heal. You find out the cause, what's the reason for edema there, okay, and go for the treatment. Presence of ischemia or necrotic tissue, wound is not going to heal in time. We need good blood flow there. If there is no blood flow at all, wound is not going to heal. Topical agents, they also hamper the process of wound healing. Important examples are again corticosteroid topical agent. Ionizing radiation will cause delayed wound healing. Okay, if somebody is exposed to ionizing radiation, there is decreased chance of wound healing because of the damage of the tissue there, because of the damage to the blood vessel as well. Low oxygen tension or hypoxic condition, wound is not going to heal in time. We need good oxygen there. We need good oxygen supply there. And never forget this very, very important point. Any foreign body which is present in the wound is not going to heal in time. We need to remove that foreign body immediately. Okay, so these are